Good morning, or good afternoon, I should say. Thank you for joining us today for this SPA Live. My name is Che Rao, and I'm the Director of Communications at the School of Public Affairs at American University. And thank you for joining us for this talk on SNAP and the new debt limit, assessing the social impact. I'm joined this afternoon by Katherine Engel, who's a PhD candidate at the School of Public Affairs, and who focuses her research on food equity. I'm also joined by Professor Taryn Morrissey in our Department of Public Administration and Policy, and whose work centers on examining and improving public policies for children and families. We are here today to discuss their recent article in The Conversation. The GOP's proposed expansion of SNAP work requirements targets many low-income people in their early 50s, but many of them already work. This article was written prior to the new debt limit agreement that was passed earlier this month. However, many of the policies that they discuss in the article were eventually enshrined in the agreement. So we are here today to discuss the effect of the expansion of the work requirement and what it will mean for society going forward, at least for the next couple of years. Thank you both for joining us today. Katie, I'd like to start with you. I think when we were talking prior to starting, you'd said that, SNAP work requirements have been in place for a long time, at least since the 1970s. But prior to this bill, what were the requirements to receive SNAP benefits?
Yeah, so prior to this bill, there were work requirements in place for what are called ABODs. And these people are able-bodied adults without dependents. So essentially, if you were between the ages of 18 and 49 and receiving SNAP benefits, and you didn't have a dependent child in the household under 18, and you didn't have a documented disability that prevented you from working, you were required to work 80 hours per month, which is, about 20 hours per week. So it was mainly that population that was the subject of previous work requirements.
This sort of harkens back to an idea that has been, like you said, the work requirements that have been in place since the 1970s. So why are those kinds of requirements in place, especially in this country? What would be some of the thoughts behind having work requirements at all?
Yeah, it's a good question. And I think, you ask 10 different people, you'll get 10 different answers sort of question. I think a lot of it has to do with this idea of moving people from, dependency on government, on social programs, and into self-sufficiency in work. And whether that idea is actually, played out in the empirical literature, I think is more open to discussion and debate. But I think that's sort of the ethos of the idea of having work requirements in place.
So this bill raises that limit to 54 from 49. And I think there was talk about raising it to 55. It was lowered to 54. What was the rationale behind that? And what does that help some folks, or is it going to hurt more folks than it helps?
Yeah, I think it's sort of a mixed bag. So originally when we wrote this article, the proposal was increasing the work requirement to 55. As you mentioned, it's now 54. So that 1 year age decrease. And we found in our article that about half of these people are already working what we would consider full-time schedules, are already working 41 to 51 hours a week on average. And so I think the idea was, can we sort of push the people at the margin of working into labor force participation or increasing their labor force participation? Again, with this idea of let's get these people self-sufficient, quote unquote, and off public benefits.
Is there any evidence to suggest that there were not working on purpose or deliberately keeping themselves out of the workforce?
The evidence, as Katie described, in our article, we found that about half were working full-time jobs. The other half were, many of them were disproportionately spending time on childcare and elder care, and anybody who's a parent, anybody who has cared for aging relatives, knows how expensive and how difficult it is to find childcare and elder care and to pay for it. And so they were also disproportionately attending to their own health needs, so seeking health care on their own relative to those who met the work requirements. And so there's not evidence that these are, even the term able-bodied adults without dependents has this connotation that these individuals are able-bodied. They're able to be working, they're just not. And the evidence suggests that they are working, and when they're not, it's often for reasons other than just choosing to sit out of the labor force.
And if that's the case, that they're caregivers, really, either helping take care of children, in some cases grandchildren, or other people's children, or they're taking care of older parents, what is the effect if they're now forced into the labor force to get benefits, or they lose their benefits, what does that kind of effect then be on childcare or elder care or caregiving in general, I should say?
There's a large literature that when parents don't have childcare, they step back from the labor force. So it's very possible that these individuals are grandparents or aunts and uncles helping to care for relatives while the children's parents are working. And parents need childcare to get to work. The vast majority of us do. My children are in school, and when they're not in school, I have a harder time working, right? It's just like transportation, it's an infrastructure. And because we lack a childcare system, we lack a comprehensive long-term care system for the elderly, for individuals with disabilities, we're left with family members filling in. And when family members then are subject to these work requirements, they're not going to be able to fill in, and that's going to be problematic and have cascading consequences.
I guess to piggyback on that, during the negotiations, was there any sort of, are you aware of, but was there any sort of talk about it or any data that would suggest that this was going to have an effect on caregiving responsibilities, or is that just something that was a blind spot as these discussions happen?
Yeah, so my understanding is that because this is a population that officially they don't have dependents in the household, right? These people don't have household children under 18, that it was perhaps less of a topic of discussion than it actually warrants. And perhaps there was a lack of awareness that although these people don't have young children in the home, their grandparents, aunt and uncles, etc., friends, family that are providing these essential childcare and elder care functions, even though they might not live with these people directly.
So to get back to that, so, there's these group of people that now are under these work requirements and who may have been remove themselves because of caregiving responsibilities, maybe forced back into the workforce, or may choose still to stay out. What is that? What is about the work requirements that make it difficult? I mean, do people not report and then don't actually avail themselves of these benefits? Will it drop participation just because there is a work requirement that they have to report?
Yeah, so the sort of fortunate sort of trade-off with the bill that ended up being passed is that there are exemptions for work requirements for, I think it's youth transitioning out of foster care, veterans, and the homeless. So there's some evidence, the CBO came out with some reports recently indicating that perhaps total staff participation might increase or stay stable, despite the fact that we have these expanded work requirements for this 50 to 54-year-old population. I think the concern is that SNAP is already a pretty onerous program to participate in. There's a lot of documentation and reporting requirements to obtain and maintain benefits. So the concern is that just by adding that requirement, even if you're already working, this doesn't change your decision to work, you might be unable to pull together the documentation or to update that documentation consistently enough to gain or maintain benefits. And so it's this whole idea of administrative burden, right? When we make these programs more difficult to participate in, we see fewer people jumping through the hoops in order to actually secure benefits to which they are eligible and entitled for.
I've seen work requirements be called paperwork requirements. They're effective at decreasing the cost of public assistance programs not by getting people who should not, in terms of deservingness, whatever the metric is, and not in terms of getting those people off and working and being self-sufficient economically. It's effective at reducing the roles because people are burdened, as Katie noted, like just signing up for the program or re-enrolling in the program, right? We know that providing a pay stub or making a visit to a social welfare office is really burdensome, especially if you have caregiving responsibilities or if you have special healthcare needs, or you don't have a car. And so again, these work requirements are effective at reducing the roles, but not necessarily in the way that they're framed. They often keep people who are eligible and by law entitled to these benefits from receiving them.
I mean, I guess that spurs my next question, which is, the idea of work requirements would be to kind of entice people to participate in the labor force. Is there anything to suggest that people actually do participate in the labor force more because there are work requirements in place?
I think, there's somewhat mixed. It depends on the specifics, right? There's somewhat mixed results, but I think in general, what we see is people do enter the labor force. I mean, first of all, most SNAP recipients, most households receiving SNAP are in the labor force. The vast majority of households, even if they're not subject to work requirements, they are working, many full time. The problem is that the jobs they have pay low wages. and they often don't offer benefits such as employer-supported health insurance. And so, the problem really is job quality, not a lack of willingness to work. That's the widespread problem. So, if you work a minimum wage job, particularly in many of the states that still only have the federal minimum wage, you can work 60 hours a week, and if you have a family, still be under the poverty line. That's not sustainable or by design. We have to fill in the gaps with SNAP and Medicaid. And work requirements underpin so much of our social assistance programs, whether it's SNAP, as you noted, has had work requirements since the 1970s. Welfare reform in 1996 added work requirements to TANF, which is our cash welfare program, which also has a 5-year lifetime limit. The Earned Income Tax Credit, which is a major anti-poverty program, is by definition only available to those with earned income. So work requirements are very, very common in U.S. social policy.
Yeah, I would also just note that SNAP benefits, in 2023, this year, the average SNAP benefit for a family of 4 is $684, and for a single person is $195, right? So this is a non-trivial amount of money for low-income families, but it's not enough to sort of make up for a substantial decrease in labor force participation by any means.
That's an interesting point.
And you can't use your SNAP benefits to buy a bus ticket, to pay rent, right? It is only for food to be prepared at home.
That's an interesting point, right? So how crucial, though? I mean, we're talking about this, and we're talking about the fact that people may be losing these benefits because of this additional requirement or an expansion of the age limit. But how crucial, really, in our society, or how are SNAP benefits for low-income people?
Yeah, I would say they're the cornerstone of the U.S. Food assistance safety net, and they're actually, they pull more people out of deep poverty than any other means-tested program. So they're hugely important. And in addition to reducing food insecurity and poverty, Taryn's done some great work indicating that SNAP benefits, for instance, increase healthcare utilization. So they have sort of this cascade of positive benefits in addition to just reducing food insecurity and poverty.
Okay, well, we have our first question in the comment section, so I think it's time we can open the discussion to some of the questions. But this first question really is, we're talking about work requirements, we're talking about how it affects SNAP and how this is the cornerstone of our food assistance programs in the United States. But is there anything different about the work requirements set out in this bill that would help people join the labor force or give them guidance in doing that, or is it going to, I saw the report from the Center for Budget and Policy Priorities that 750,000 people will lose benefits because of this bill. So is there any upside?
Yeah, to my knowledge, there isn't anything in the empirical evidence that would suggest that these work requirements will have a different effect than past iterations of work requirements have. Sort of every time the Farm Bill comes up, you see different sort of debates and funding schemes for various employment and training programs related to SNAP. But to my knowledge, there's nothing to suspect that this would radically change the incentives to enter the labor force for this population.
Mm-hmm. Yeah, it's not like these work requirements are coming with educational benefits or skills training. We know that, fortunately, unemployment is low. But what jobs are open don't necessarily match the skills for the people who are looking for jobs. And so that mismatch is also creating, a lack of employment among some individuals. But it's not, the work requirements in this new law don't address that. They're just requiring work, not connecting individuals to skills or to jobs.
So then if people are going to lose benefits because of this, is there anything else that can make up for this? Knowing how crucial SNAP is, are there other programs out there that they would be eligible for that would make up, or is this sort of like now you're a little bit on your own?
Yeah, I would imagine that, during the pandemic, when we saw this massive disruption in employment, we saw a lot of people relying on private charities, food banks, food pantries, things like that to sort of supplement SNAP benefits, even when SNAP benefits were raised during the pandemic. So if I had to prognosticate or guess here, my suspicion is that those sort of private or charity forms of food assistance will see an increase in demand as people lose their benefits.
Yeah, there's our safety net, our public safety net has a lot of big gaping holes, and this just made a hole a little bigger. Unfortunately, there's not a lot to backfill. The earned income tax credit, again, is a fantastic program, keeps raises people out of poverty, but you have to have earned income. We have cash welfare, which serves a very small percentage of households in poverty. We have Medicaid, which is our largest by spending social welfare program. That's health insurance, a vital cornerstone to what we need as individuals or as families. But that's not going to pay rent. That's not going to help you meet your day-to-day needs. And so, yes, the private safety net will be more stressed, is my prediction. And the exemptions for work requirements for individuals experiencing homelessness and for veterans were an important step. And as Katie mentioned, might offset the net change in enrollment. But what we're going to see is presumably fewer people age 49 to 54 participating in SNAP who are eligible because of work requirements or other paperwork and other issues. And we might hopefully see increases in veterans or experiencing homelessness receiving SNAP.
Okay, well, I mean, we don't have a ton of time, so I wanted to kind of put you guys in the policy sandbox, if you will. But if you were helping write this bill and you were thinking about SNAP and if work requirements did have to be in place, how would you do this to actually increase participation or at least provide support to people who may need to either go back to the workforce or find another way to increase their benefits? But there obviously you kind of alluded to some of those things, but what would be some concrete policy proposals that you could put forth to make this more equitable?
I could think of a couple. I mean, a training and connection to community colleges, other kinds of skills training seems important. Certainly have periods for job search. Other social programs like childcare subsidies have work requirements as well. And so that some of those similar kinds of job search time and connection to skills and education training are included in that. I mean, the other is really streamlining enrollment and re-enrollment procedures and extending the certification period. We know that with SNAP, childcare subsidies, other programs, Medicaid, that when people leave those programs, they're not doing so because they have a better paying job and their incomes are too high to qualify. They're largely, in general, they're leaving because of they couldn't get the right paperwork, they couldn't sign something in time. And so it's this administrative burden. So having things online, assisting with people, having libraries be able to help people enroll, not requiring in-person visits or periodic visits or time-consuming phone calls, those sorts of things can go a long way.
Yeah, I certainly agree with that point. And I would also add that I think one of the challenges too is just streamlining the actual, if we have to have work requirements, right, make them as easy to comply with and document as possible. Because with these administrative burdens, we see that sort of the argument for having them is to reduce fraud, but rather than identifying, the small number of people who may be receiving benefits and when they're ineligible, they actually push many more people out of the programs who actually are eligible. So, assuming we're operating in a world where we need to have some work requirements, I think really making that the paperwork burden as minimal as possible is the way to do it. And then my only other additional point, I think, is sort of making some sort of allowance for the fact that even though you're not, participating in paid labor by taking care of children and elderly adults, this is labor, this is work. So having some sort of exemption that acknowledges that unpaid labor as a legitimate form of work, I think, is important.
Thank you for your time. And to everybody who joined us, thank you for joining us. Thank you, Taryn. Thank you, Katie. I appreciate all that you do for us at SBA.